Good afternoon, everyone. My name is Lee.Kim. I am Director of Thought Advisory in Privacy and Security at the Healthcare Information Management Systems Society, a multinational not-for-profit organization that is dedicated to advancing healthcare through healthcare technology. As you all know, cyber attacks are very much the norm across any industry and any sector pretty much around the world. And in healthcare, where our business is saving patients' lives, prolonging their lives, maintaining their health and well-being, unfortunately, the technical staff need to worry about cyber attacks and other cyber compromises that threaten the well-being and well-functioning of the healthcare ecosystem, as it were. Why is cybersecurity really important in healthcare? And the reason why it's really important in healthcare is because, frankly, everyone needs healthcare. And nowadays in healthcare, we all have technology to run it: electronic health records, health information exchange, clinical decision support, whatever it is. We all need healthcare, and technology is the engine that runs it. Let me also talk about the legislative and regulatory aspect of healthcare cybersecurity. In this case, the key regulation is HIPAA. You might ask, well, why? It's because not only do you have to make sure that information is protected, but you have to also make sure that information is protected in the manner that complies with the regulation. These regulators essentially have a general framework within which they believe that security standards should flow and how it should be implemented within an organization. There's a direct link between patient safety and cybersecurity. Now, it has not been proven yet, or reported, I should say, in the news that a patient has actually died as a result of some kind of cybersecurity mishap, such as a cyber attack or a device being disabled through a DDoS attack. But that's something that some people, at least in the healthcare industry, predict. So, top threats within healthcare. First top threat is phishing. So phishing is a way in which a person on the other end, an employee that's within the hospital, and so you send them a nice phishing email to elicit sensitive information like credentials, send them something that's malware laden through a poison link or attachment. You get to circumvent that perimeter and deceive that person into doing essentially your bidding so that you can get in that system and or you can get that nugget of information that you're looking for. Social engineering, such as by way of calls, is also another problem. Essentially, there's scammers that are asking for the credentials of surgeons or whomever picks up the phone. Ransomware, of course, where your system gets disabled, supposedly, and unless you pay Bitcoin, when most people are in that situation, they'll give in to the demands. But there's no guarantee, really, that you'll be able to get the data back. Other top threats you can see here, unfortunately, insider attacks are very much a problem as well. Top threat actors, this is essentially a complementary list. So what are threat actors after? Again, in order of precedence. So financial information such as business email compromise is one goal. Another goal, of course, is employee information, patient information. Threat actors may also be after intellectual property. This is especially true for academic medical centers. Researchers tend to want to share. They're more open. They're more willing to help. So perhaps that phishing attempt may be more effective, or maybe the cybersecurity controls may be less tight. So phishing. As I said, phishing is a key way, unfortunately, that these threat actors are getting in. I can say this in terms of phishing generally. Spear phishing emails are the most deadly, shall I say. They're targeted, and actually there are spear phishing emails whereby there are artificial intelligence engines available out there to automatically generate a tailored email to a certain target. So I do have various examples in terms of phishing and whatnot, and you can certainly look through that. And as you can see here, something that's widely done in social media and sometimes emails with shortened URLs. You oftentimes, of course, can't see where that leads to, so it's very easy to hide a malicious link there. Security defenses. Let me just say a few words on this. So you might be surprised, according to our research, according to our surveys as well, almost everyone nowadays has antivirus software and firewalls, but not everyone. If there are basic controls to have, it is at least those things. So as you can see, we need a lot of help within healthcare cybersecurity. There's so many possibilities. Healthcare cybersecurity and cybersecurity generally is really a hot topic.